Good evening, everyone. Today, we are honored to have Dr. Robert Redfield with us, a virologist with more than 35 years of experience in infectious diseases, former director of the U.S. Centers for Disease Control and Prevention, senior public health advisor to Maryland's governor, and a leader in global health and biosecurity policy. He served in the U.S. Army as a colonel, co-founded the Institute of Human Virology at the University of Maryland. You are most welcome, Doctor. My first question, what do you think about the intro? Is it accurate?
Yeah, pretty good. You did well. You did your homework.
Thank you so much. So we're going to ask about MAHA, Make America Healthy Again. It's like the phrase is gaining traction. From a medical standpoint, what does that actually mean? Is America less healthy today than it was 20 years ago?
Absolutely.
Mhm.
And it's important to turn it around. One of the things that happened during the COVID pandemic is America had a lot of people die. We had over 1.2 million people die.
Mhm.
Other countries like Taiwan had less than 5,000 people die. And the President Trump used to ask me, why did so many people in America die when we have high quality medicine, et cetera? And I had to explain to him is because we're not healthy. And this is what Secretary Kennedy is trying to really turn around. When you realize that 77% of young people that want to potentially join the military cannot pass the military medical exam, or when you realize that we have over 20% of our adolescents are obese, or over 30% have type 2 diabetes, we've become a very unhealthy nation, and we need to turn that around. And that's really what MAHA is about, is to try to get people to focus on making America healthy again by trying to confront some of the chronic diseases that we suffer,
Yeah.
most notably obesity and diabetes
And
in
heart
particular.
and heart disease as well. Yeah, doctor, why has the public health system focused more on crisis than prevention?
Yeah, it's very sad that there is a lack of interest in investing in prevention.
Mm,
An ounce of investment in prevention could prevent lots of disease. It's been that way for a long time. Hopefully, some of that will change. One of the things that Secretary Kennedy has done, I think, is to put a focus on the importance of food when it comes to our health, and really has begun to do that. I mean, I thought it was at the Super Bowl, the ad with Mike Tyson, when, you would say something as radical as eat real food. And
exactly.
that's to eat real food. Because unfortunately, the American public has gotten away from that, eating a lot of artificially, processed food, sugar food, and we're really trying to get people back to the focus on eat real food. I do think the revision of the nutrition guidelines, where they put protein at the center of the plate, as opposed to carbohydrates, I think is a positive thing. I think removing a lot of the food additives, very important. I think trying to move away from processed food. I mean, there was a study that NIH did a number of years ago where they put people in a metabolic unit
Mm,
and they fed the same amount of calories, the same food, and they had the same amount of exercise. One of the foods, though, was highly processed, and the other one was not. And the group that ate the highly processed food gained substantial weight,
wow.
whereas the group that ate the non-processed food did not gain weight. And a lot of people commented, when they go on a vacation to Europe and they go to Italy and they eat really well, they
Yeah.
come back, they didn't gain any weight.
Mm, mm.
But in the United States, it's this highly processed food that's a real problem. So I think Kennedy's going to make a lot of progress in that, hopefully in the first,
Yeah, yeah, yeah,
the
yeah,
first couple of years to turn it around.
yeah. MAHA is prioritizing metabolic health and immune resilience, and this is like a national security priority, isn't it?
Well, I would argue when 77% of your young people can't qualify to join the armed services, that's a problem.
Mm,
I
mm,
spent 23 years in the Army. When I went through my exam to join the Army in say 1973,
mhm,
I think probably less than 3 to 5% of people failed the exam.
mm.
Now it's 77%.
This is a high rate.
That's a problem.
Yeah, in your opinion, does the CDC drifted away from its core mission of disease prevention into political messaging?
Well, I think CDC's primary mission is to be a public health response agency, particularly to infectious disease epidemics, pandemics.
Mhm, mhm,
And I do think they've moved far away from that from the time they were founded in the late 40s. Probably somewhere in the early 80s, they started moving more and more into different areas. When it started, it was the Center for Disease Control after it moved out of the Defense Department. And when I took over, it was the Centers for Disease Control, and we had multiple centers. I think I had 27 different centers,
mm,
and all types of different priorities. Um, and so I do think it's not focused on its primary mission. Now, I do think Kennedy is moving this chronic disease prevention into HHS as a priority, probably through HRSA. I think it's really important to go after chronic disease.
mhm.
But I also think for CDC, its mission is largely to be a public health response agency.
I agree with you absolutely. Do you believe that the pharmaceutical system contribute to chronic illness? And has big pharma gained too much influence over public health policies?
I think there's probably too much influence. Kennedy will talk about corporate capture. Obviously, the lobbying power of the pharmaceutical industry is really enormous. Um,
Mm,
I'm not a fan of having pharmaceutical ads on commercial television for lay people. I think we should take those away. I think we should go back and just advertise in medical journals, but not spend these billions of dollars they're spending right now for you to get an ad on television. I mean, I really think you can't watch a television show without getting a bunch of ads for different
yeah.
pharmaceuticals. And the American public doesn't really know what they're hearing. I just think we need to go like many other countries have stopped allowing or never allowed pharmaceutical companies to directly advertise to the
Mm.
public. I think they should take that away. I don't think they should advertise in lay magazines. I think it should be restricted to medical journals, medical magazines, and to medical professionals.
Yeah. This is can help a lot. So, okay, do you agree that Americans are over medicated? Uh, Lots of
Yeah, I do think there is a tendency in American medicine today, and a tendency from the American public that when they have something wrong with them, they want a pill. All right. And
immediately.
I think we overuse medication in many different circumstances.
Mm,
And it even could start at a young age with trying to treat hyperactive children. And
mm,
how many of those children are put on Ritalin and other medications. So I think that's true in our country. Rather than say go out and take a walk, run around the block, go play some sports. There is a tendency to, I want a medication, give me a medication, give me another medication. I do think we're over medicated.
yeah. Do you have any suggestion like reforms to build the trust between doctor and patients?
To rebuild the trust?
Yeah, between doctors
Yeah,
and
yeah, I think it's very important. I just wrote a book called Redfield's Warning, which came out about 8 weeks ago, 10 weeks ago. I encourage your audience to read it. And, one of the reasons was my concern about biosecurity and gain of function research and the threat of bird flu, which I think is real. But the other warning was the loss of public trust.
Mm,
The real way to rebuild doctor relationships with patients is for doctors to spend time talking to patients.
Yeah, they don't have time. You go for a
You got to spend time talking to patients. Um, a lot of people misinterpret Secretary Kennedy, and I know him well. I'm one of the big advocates for vaccines in the world, but I want honest discussion about vaccines, honest discussion about their risks, side effects, and efficacy. And that's all that Kennedy wants is an honest discussion about vaccines. And I think the new policy that they've come up with on vaccines, which has taken a lot of criticism from a lot of the medical establishment, actually, what that policy says is parents should talk to their doctors about their childhood vaccines and the recommendations and
Mhm.
spend more time communicating directly with doctors. Here's 11 vaccines we think everyone should take. But ultimately, it's a personal choice. Here's six more that we think certain people should take in certain circumstances, and here's six more that we think you should talk it over with your doctor and let them
Yeah,
decide whether
yeah.
this is the right thing. So I think spending more time speaking to patients. I think when you get a health system that decides the answer to a question is for me to tell you what you have to do,
Mm,
going to mandate this COVID vaccine. I don't care what you think, you need to take it. I think that's the wrong approach. I think the right approach is to sit down, discuss it. You
mm,
don't want to take the vaccine. Why don't you want to take the vaccine? Okay, let's talk about it. Okay, what are your concerns? Okay, those concerns are valid or they're not valid. And, let's spend time working with
yeah.
patients.
Mm,
I had a program when I was CDC director where it was a program called Vaccinate with Confidence. And the key to that was many of the parents didn't want to vaccinate their children, not because they were against vaccines, they were just afraid of making a mistake. So talk to them, let understand their concerns. If they're incorrectly informed, try to correct it. Maybe it just takes two or three different visits
yeah,
to get them to decide to vaccinate with confidence rather than just say you need to vaccinate and I'm the doctor and here's what you need to do.
yeah.
I
That's
think more time speaking to patients,
yeah.
respecting their concerns and opinion,
It's
not belittling them because they may have a different point of view.
yeah.
These are important steps in
Mm,
rebuilding confidence
mm.
between doctors and
Yeah,
patients.
yeah. I'm curious to know since you are advising Secretary Kennedy and the MAHA framework, what would be your top three health reforms? You can start with it immediately. What is your advice for him?
Well, I think, we obviously have to have you have to have dialogue. You have to allow you have to allow difference of opinion to be expressed freely. Um, for me, I agree with what Kennedy is doing right now in trying to redefine the importance of real food and to really educate people about the importance of nutrition and food.
Yeah.
Um, I think we should, as I mentioned, we should get rid of commercial advertisement for pharmaceutical
Mm.
products on television.
And the
I think,
third thing,
pardon me?
and the third important matter you have to solve, which
Well, I think it's obviously I think we have to move our health system. Probably if you want to put something on top, number one, we have a disease system. And we have to build a health system.
yeah.
What I mean by that is we have to really move towards what I call value-based healthcare. I still practice medicine, and I'm paid for how much time I spend with you. I'm not paid for whether I keep you healthy,
Mm.
right? And much of the incentives in medicine, unfortunately, are we're compensated if you're sick. I don't want to be compensated if you're sick. I want to be compensated if you're healthy.
If
So I
you
really think we have to move the whole system towards what I call value-based healthcare and build a health system. Right now, we have a disease system. So that would be my number one, to
perfect.
build a health system.
Yeah, I want to talk before we end this conversation about the president health and the transparency about it. Recently, there had been media discussion about the president taking aspirin. and other routine medication. In general, how important medical transparency should be in a case of a president, the leader of the United States, and what you can say in this regard?
Well, I think there should be some degree of transparency. I mean, I think the president is allowed to have uh, some ability to keep some things, to himself if he chooses, or herself if she chooses. Um, I've found when I worked with President Trump that he was quite healthy. He had enormous stamina. I mean, the guy works, 18 to 20 hours a day, and he was always well prepared. And whenever I interacted with him, so I'm not, so sure that just because you're president, you have to forego what we would say medical confidentiality. I think if the president felt there were things that he had that may impact his ability to do his job effectively, then he owes the American people that information.
Yeah, he have energy more than a person in his 20s. So, but my question,
Much more. He's very. I never. I mean, when I was CDC director, it was not unusual. I'd get a phone call at 3 in the morning, 4 in the morning. It was the president of the United States. He was up. He was thinking. He definitely. I don't think he sleeps more than 3 to 5 hours a night.
yeah, yeah. But my question was for his age, his late 70s or 80s, is daily aspirin typical preventive care, or what do you
No,
think?
I take daily aspirin. There's controversy about it in some of the recent medical literature, but I still feel daily aspirin is a very good preventive
Mm,
strategy to keep me from having microcoagulation, small blood clots that could lead to a heart attack or a stroke. So, I advise all my patients that are over the age of 65 to take a daily aspirin.
That's good. Thank you so much, Dr.
Yeah.
Robert Redfield, for your transparency in answering all these questions. You're not only a great former CDC director, but you are a U.S. Army colonel and lifelong public health leader. Thank you so much for being with us.
Yeah, thanks for having me. God bless. Bye bye.